My behavior change project is for food selectivity. So the research I found was on food selectivity. I'm trying to increase the intake of new food in a client. And the authors of the article I will be referencing are Saverling, Kokitas, and Williams in 2012, who studied a 3-year-old that was diagnosed with autism, and it was conducted in a clinical setting where there was only one table, 3 chairs, and a high chair. They collected latency data on the time between bite presentation and acceptance of the bite. 4 out of 12 target bites were presented on a plate A. So plate A is the non-preferred food for a period of 10-minute meal time. If he accepted bites off plate A, he was then presented with bites from plate B, and plate B was preferred foods, so foods that he liked. The acceptance of the bites on plate A had to be done within 5 seconds, and they resulted in behavioral or verbal praise, while bites that were not accepted in 5 seconds were terminated. On plate B, each bite was presented for between 5 and 30 seconds, and for each bite, he was able to select the bite of food that he took. Each meal was terminated after 10 minutes of time, even if the client did not accept any bites. Differential reinforcement of target behavior, escape extinction, and fading were used as part of the intervention. The first phase required the client to take a bite of the presented food before he was allowed access to escape from the meals, and refusal did not result in meal termination. After the client mastered 4 foods, so 4 of the foods on plate A, extinction was terminated. Following this taste session were the presentations of the food to the client with a verbal prompt, such as take 1 bite and then you can be done. And then he would be allowed access to escape or leave the room for 3 minutes. The results of the study concluded that presenting preferred food after bite of not preferred food did not increase after 5 meals. However, with escape extinction, DRA, and fading were used, the client's intake of preferred and non-preferred foods did increase. So in the Sieverling, Kokitas, and Williams study in 2012, it's very useful to me in my study because I'm using preferred foods as a reinforcer or as a reward for trying new foods, along with other more valuable rewards. The implementation technique for increasing the intake of new food used a very similar method in this article, as I just stated. The food is presented for periods of time in 20-minute meals with my client. So it's not the 10 minutes like it was in the research, but it's the 20 minutes. I tally each bite, and the client receives verbal praise. So overall, this is one of the most valuable studies I've found. And again, the authors are Sieverling, Kokitas, and Williams. It was written in 2012, and its title is A Clinical Demonstration of a Treatment Package for Food Selectivity. Thank you.